Greetings, and thank you for joining this talk on institutional policies, procedures, and practices and implications on the health status of LGBTQ plus communities. I am Dr. Darrin Johnson, the Executive Director of BU Wellness Network right here in Indianapolis. A large part of my work has been engaging Black LGBT communities for HIV prevention and care. In today's talk, I will make reference to my background on a number of occasions as an example of engaging LGBTQ plus communities. It's important to note that discrimination is widely experienced by LGBTQ adults across healthcare and other domains, especially among racial and ethnic minorities. Policy and programmatic efforts are needed to reduce these negative experiences and their health impact on sexual and gender minority adults, particularly those who experience compounded forms of discrimination. So today's objectives, we will review CLAS standards as they have been described in previous presentations. We will also work to create an environment that fosters understanding of diversity and differences. We will describe challenges associated with LGBTQ plus health status, work to understand how past socialization experiences affect interactions, behaviors toward culturally similar and different people in the healthcare setting. And then we will identify a policy development framework for you and your organization to use in promoting positive health outcomes with LGBTQ plus communities. So when we are naming LGBTQ plus communities, it's important to understand that this is a very diverse group of individuals when we're referring to this sort of larger part of the community. So it is diverse in gender identity, sexual orientation, race, ethnicity, geographic location, social networks, culture, and in how these individuals access equitable healthcare. Oftentimes, we refer to LGBTQ plus individuals as vulnerable, marginalized, and sometimes hard to reach. And I would advise that we not continue to use this language, particularly because the way that these individuals might be considered hard to reach has a lot to do with how we are culturally or appropriately engaging them in our programs and services that might create barriers to their care. So they're not necessarily hard to reach. It's just that our policies and procedures and practices within our organizations have made it hard for us to have the best access. And then we have to ask ourselves, why are these communities considered vulnerable and marginalized? And oftentimes it's related to stigma and discrimination, related to external factors based on the perceptions of how society views individuals who identify as LGBTQ plus. So in naming types of discrimination, we have homophobia, transphobia, biphobia. There's also racial discrimination, and then discrimination related to socioeconomic status, particularly those who are among lower socioeconomic status. And then there are racial microaggressions, which I will address shortly. So about a year ago, I gave a talk on removing the residue, talking about microaggressions, how they are byproducts of racism. So racial microaggressions are racial legacies of the past continue to haunt current policies and practices that create unfair disparities between minority and majority groups. For example, a racial microaggression that I've experienced is individuals asking how, as a Black man, that I am able to have a PhD. Another layer to that is understanding that the work that I do as a Black man as a priority of engaging Black same-gender loving individuals, or me prioritizing engaging Black same-gender loving individuals. So when you look at that example as a microaggression, these are often things that we miss because we don't see them as significant or important, but they could create barriers when you are having conversations with your colleagues about discrimination as it relates to race and LGBTQ identity, but especially your clients as you're engaging them in your programs and services within your organization. So it's very important that we pay special attention to how we are communicating with our clients and what we see or what we deem appropriate as it relates to racial microaggressions. So we have to be mindful as providers and practitioners. And mindfulness is, acts as a bridge between our knowledge of cultural differences and our responses to them. It helps us apply our broad awareness of culture to understand unique cultural settings. So we have to be mindful of our clients and the uniqueness that they bring with them when they access services within our organizations. We have to understand them from a cultural background, which is more so this sort of micro, a macro idea of how they show up. But also, we need to understand them as individuals and how they are positioned within that culture and their experiences. So we have to be extremely mindful, again, as providers and practitioners, because this will help us better engage our clients when they are accessing our programs and services. But in understanding that, we know that intersectionality is important. People or individuals need appropriate labels, but they shouldn't be seen as just one label, right? People show up within in our organizations to access our services, and they bring different experiences with them as it relates to their race and ethnicity, their educational background, their sexual orientation, gender identity, their age, and etc. So we need to better understand the whole experience of our clients from an individual level, but how they are positioning themselves with their experience, and how that can be a barrier if we're not understanding that when they're accessing our services. So key populations, overlap, right? We can't just see our clients as this individual thing, and then they need one thing when they walk into our organizations. So silos do not exist, and we have to understand that. And when we are engaging our clients, we have to make sure that we are framing our work in a social justice context. So what is intersectionality? It is a theory of how different types of discrimination interact. This theory is rooted in Black feminism and anti-discrimination, and it was coined by Dr. Kimberly Crenshaw. What's important is over the years that although this was rooted in Black feminism and anti-discrimination, it also has been used to describe discrimination as it relates to LGBTQ plus identity. So intersectionality is a lens through which you can see where power comes and collides, where it interlocks and intersects. So with that, I will describe some challenges in engaging the LGBTQ plus community. So first, considering compounded discrimination, right? Race and or racial microaggressions, sexual orientation, and gender identity. And when you consider these things as compounded discrimination, now think about our healthcare organizations and clients carrying this and these burdens in addition to their health status, whether positive health status or health status or what's considered negative health status. So think about mental health. Think about HIV or people living with HIV. And more recently, think about individuals impacted by COVID-19 and some of the laws and policies that have been developed around, mask mandates and people being impacted by job loss and what that looks like, and how they are able to afford their living expenses in addition to medical expenses and taking care of family members related to COVID. So all of these things, in addition to their lived experience and what they already are accustomed to regarding race, racial discrimination, racial microaggressions, sexual orientation, and their gender identity. These are forms of compounded discrimination that we have to be mindful of when we are engaging our clients. So even in the anticipation of or mental preparation for discrimination, whether discrimination actually occurs has significantly harmful effects on health, and they create barriers. So if we're not mindful of these things, folks might not come back to access our services. So we want to make sure that we're paying special attention when we're engaging our clients. And also, we have to acknowledge that people cannot separate their identities because identities do not cause trauma and they do not cause harm. Therefore, you cannot decide which one causes more harm, because that is not the case. And we don't want to ask people to remove their personal experience in healthcare, because that can further harm clients. For example, you can't show up as you know, for me, I can't show up as a Black man one day and a Black same gender lover person the next day, right? I'm always going to be a Black same gender lover person. But oftentimes, clients feel like they have to, you know, sort of reduce, you know, one of their identities in order to be in a space that is majority space, particularly heteronormative spaces. So if there's a place that has um, no reference to LGBTQ identity, clients might not feel welcome in that space. So we have to be mindful of, you know, how we, you know, what social marketing materials we have, you know, in our lobbies in our organizations, or what type of language are we using when our clients are in our presence, and how we are communicating our policies and practices to our clients, and if we are explicitly saying that this is a welcoming space for LGBTQ plus people. And if we're not, then we could be causing harm for these communities. So we have to acknowledge how people show up. And then we understand that stress and trauma in this context are caused by external factors that create internal negative feelings of oneself. So again, understanding race and racism and microaggressions and how they can continue to create barriers, but also if we're not creating welcoming spaces, then they could be seen as homophobia, transphobia, and biphobic, places for LGBTQ plus communities. So these are some of the responses to harmful discrimination and microaggressions. So guilt, withdrawal, fear, self-harm, loss of self-worth, denial, shame, isolation. So these are things that our clients might go through based on societal's, you know, how society treats the LGBTQ plus community in particular. And also think about how we engage our clients in our healthcare setting and how we could perpetuate, you know, harmful discrimination and microaggressions that lead to these things as well. So the previous slide shows some of the psychostressors that our clients, you know, might be impacted by, and these are also supported by the minority stress theory. So this examines the ways in which the unique stressors experienced by minority individuals may relate to mental health disparities in health. And then, for example, because of my experience, you know, these are Black gay men have significantly been impacted by these psychosocial stressors in particular. And they sometimes lead or often lead to poor mental health outcomes and other poor health outcomes as well. So we have to be mindful of you know, those psychosocial stressors and be able to address those things appropriately when our clients are impacted by those. So now I want to briefly review CLAS standards. And again, these were you know, laid out in previous presentations. So I want to just, again, acknowledge the principal standard to provide effective, equitable, understandable, and respectful quality care and services that are responsive, to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs. So some ways that we want to make sure that we are acknowledging those CLAS standards in our organizations. The first thing is we want to look at governance, leadership, and workforce. We want to advance and sustain organizational leadership that promotes CLAS standards, class and health equity through policy practices and allocated resources. And we do this particularly with engaging LGBT community by recruiting and promoting LGBTQ plus leaders in our workforce within our healthcare organizations. And then we want to have LGBTQ plus health program specific policies and practices. We want to you know, introduce ourselves with pronouns as an example of acknowledging that we are moving towards you know, effective CLAS practices with engaging LGBTQ plus individuals. We want to review and enhance our internal policies that explicitly name and promote positive health outcomes for LGBTQ plus individuals and support health equity for Black health. I'll be remiss if I didn't say that because of the background and prioritizing Black LGBTQ plus health. And then we want to make sure that we are supporting training and professional development for our healthcare workers, those who are not LGBTQ+, but those who work with LGBTQ+ people, in addition to the leaders that we are recruiting and promoting in our organization. We also want to offer language assistance and create easy to understand print and multimedia materials and include LGBTQ presence. So for example, as I indicated earlier, we want to have social marketing materials in our front lobbies, throughout our organizations and our office spaces that include LGBTQ+ individuals and are welcoming to LGBTQ+ individuals. So what do your brochures and flyers look like? What is the messaging that you are using when you are communicating with LGBTQ individuals? If you have radio advertisement or advertisement for TV or billboards, like what does that look like, and does it include LGBTQ individuals in a way that is welcoming and helping them understand that your organization and your services are for them? So these things are important to consider when we are looking at building culturally and linguistic appropriate services for our LGBTQ+ communities. And then we want to make sure that we have continuous improvement, throughout our organization, and hold our organization's leaders accountable and making sure that we continue to have CLAS standards and engaging LGBTQ communities. So what are our goals in establishing these policies, and how are we going to hold management accountable when we are carrying out these policies and procedures? And then we want to look at how we are partnering with the community. What community leaders do we engage in developing CLAS-related activities within our organization? And then how do we communicate the organization's progress to the community to let them know that we are having forward movement and making sure that our spaces are welcoming to their peers, themselves and their peers. So some implications for practitioners in doing this work is that we have to understand that providers and practitioners have a position of power over our clients. We have to acknowledge that because that is a real thing. And we want to make sure that we, and in acknowledging that we sort of reduce those barriers in those positions of power. And how are the services that we provide are harmful? Do they perpetuate harm, or do they minimize harm for our clients? And then, and what are we doing as individuals to make sure that we are minimizing harm as well? And then sometimes we need to acknowledge that our policies and practices create barriers to care. So we need to continue to review those policies and practices to make sure that we do work in removing those barriers and changing those policies and practices in our organizations that may be outdated. They might have outdated language that might not be LGBTQ+ friendly. So we want to make sure that we change those things quickly. And in reviewing our equitable models of care, sometimes practitioners and providers say, I haven't necessarily understood this community because, I haven't had experience engaging them. But that is no longer acceptable and saying that you don't understand. Take the opportunity to engage in trainings, conference meetings, work with peers, identify LGBTQ+ leaders that you can work with to help you understand some of the background on the community. Also, take time to get to know your clients. This is a great way to understand where your clients' experiences are, what they might be going through, so that you can better understand. But saying I don't understand is no longer acceptable, and it should have never been acceptable. Also, work from a strengths-based perspective and model, right? You want to get to know your clients and be able to leverage their strengths. For example, we work with house ball communities, and we work with pageant communities, which are sort of smaller communities within the LGBTQ+ communities. But understanding the value in those smaller communities and how these clients or these individuals that might be clients engage in this this wonderful artwork, and how this can be helpful to them having positive health outcomes is as an example of a strengths-based perspective and understanding your clients and their experiences. So I would advise that practitioners and providers get to know your clients and get to know some of the things they do outside of the context of health, and make sure you're able to leverage those experiences. Also, I like to work from a FUBU model, and FUBU is for us by us. And in a research context, it's a community-based participatory approach. So you are engaging the individuals that you work with within your organizations and within the community at every level of developing programming and changing the policies and practices within your organization. So they are in the conceptualization of the idea around of creating programs and creating policies and creating practices, to the implementation, and then analyzing how this is working within your organization and how it's working with them. And within the communities that you are serving. So always engage communities that you seek to provide these positive health outcomes in your processes. Because if you don't, then it may not work, because you have not done the work in getting to know the community that you want to serve. So again, FUBU is for us by us, and that is engaging the communities that you wish to work with. And also framing all of your work in a context of social justice, particularly when you are talking about LGBTQ plus individuals who might have been discriminated against in the larger society, and then particularly those who are discriminated against because of race and sexual orientation, gender identity. So make sure you are bringing along individuals who might not feel like they have been valued in the spaces that you wish to engage them in. And that is reframing your work in the context of social justice. And then we have to move away from silos. We can't just focus on the mental health of our clients, or the HIV status of our clients, or clients experiencing diabetes, or someone who is experiencing some type of trauma in healthcare. We want to make sure that we address the needs and the immediate needs of our clients, but understanding their experiences, their culture, their background, where they live, how they access care is also extremely important, because it helps you understand the best methods to provide that optimal care for those individuals in those communities. So you can't just, do the work, address the immediate need. You want to address the immediate need and make sure that you are prepared to address other needs that your clients might be going through. And that could be within your organization, or working with a community partner to address those other needs as well. So in doing this, provider and patient interactions are extremely important. So you want to get to know your clients by, asking and not assuming. And this is important when we're talking about, gender identity and sexual orientation, gender identity related to pronouns. So, I introduce myself as, he, him, his. And it's important for providers and practitioners to do the same when you're introducing your professional affiliation and your personal affiliation too, because it helps your clients understand that you are doing the work and learning the LGBTQ plus community, and positioning yourself to make sure that you are an ally. In doing this, you want to make sure that you use correct pronouns and never say preferred pronouns, because then you give the assumption that, gender identity and sexual orientation, but particularly gender identity, when talking about pronouns, of course, is a choice. So what are your pronouns is the appropriate question, not what are your preferred pronouns. So if you've said that before, or you've heard your colleagues say that before, just do the work to make sure that you remove that, because that can also be a barrier to care. And then create gender neutral spaces. And I say this because, we want to make sure that our spaces in our organizations are welcoming for all people. But it's also important to make sure that you have programs and services that are sort of gender specific as well. So there's a fine balance in doing that. And that's a whole other presentation. So we can, talk further about that later. But I think from a holistic perspective, particularly around make sure you're having welcoming spaces, just make sure that your organizations are gender neutral spaces. When you don't understand something, or if you don't have the experience, find assistance or refer appropriately. And that can be within your organization, or that can be with a community partner. So make sure you have a list of resources that are already LGBTQ plus affirming spaces if your organization is not yet there. And it's nothing wrong with that if you're not there and ready to just provide these services to a particular community. I think what's important is that you get on a path to do this work. So in the meantime, though, you want to identify some community partners that you can work with so that you can appropriately refer if you're not able to provide appropriate services to individuals and communities who identify as LGBTQ plus. You want to check yourself and acknowledge that you have biases and differences. Your experience might be different. Your education with the community might be different. So you want to acknowledge that. And going back to saying that I don't understand, acknowledge that you're not quite ready, but you are wanting to move forward with understanding the community, because you never know who might show up in your office and you might have to provide services. So you want to check yourself and acknowledge that your experience is different, and you want to get to know your clients, and you want to get to know the community as well. And just be authentic, and you be authentic by checking your bias, seeking assistance, creating gender neutral spaces. All the things above is how you be authentic. So just be clear on where you are in this journey and providing culturally appropriate spaces for the community. And then you want to develop a picture within a picture, right? So in thinking about your organization and where you are in doing this work, right, and creating sort of this LGBTQ friendly, affirming space within your organization and in your practice, and that's extremely important. But also, what is your method of providing services from a individual provider and client or patient perspective, right? How do you provide services when an LGBTQ plus individual is sitting right in front of you in your office, right? So it's one thing to make sure that your organization is ready, but it's another thing to do the work to make sure that you are ready. So how are you framing your services, related to LGBTQ plus care when clients are sitting right in your office? What does that look like from an individual and provider patient perspective? So with all that being said, right, we want to look at making sure that we make changes across our organizations. We want to make sure that we're doing the work as individual practitioners in a direct service level. We also want to look at what's happening within the community, like what organizations and how we're working with our community partners and how they are doing the work with the LGBTQ plus communities, and sort of how we can work together to make sure that we're on this journey. Because you don't want to do the work within your organization and then refer to an organization that's not doing that work as well. And then because you can further create barriers to care for your clients. So you can do all of these great things within your organization and then not provide a service or not have a service on site where you might have to refer to another organization. And if that organization is not doing the work, that client might face discrimination. That creates a barrier to care, and they might not get the optimal care that you set up for them while they were in front of you. So we want to make sure that we're paying attention from a community perspective about what's happening and understanding not only from a provider practitioner standpoint, but also what's happening in the LGBTQ plus community and what those needs are with community members. So again, we do this by identifying those leaders, making sure that we have representation within our organization, and making sure that we have representatives from the community that can give us feedback on what we are doing within our organizations as well. And then what's happening on a policy level? what laws and policies are happening outside our organization that impact the way that we provide services within our organizations are also important things to consider. For example, this year when COVID-19 happened, we had to make some adjustments really quickly within our organizations providing healthcare to our clients. We had to have mask mandates, right? And if our clients didn't have access to masks, are we able to provide those resources to our clients? And then what organizations are our clients attending that are not providing those resources, but create barriers to them receiving the resources that they need. So that is one example of looking at, what the needs are in the community that we have to address from a policy perspective that could impact the care that our clients receive. So in looking at policy development framework, this is sort of a quick sort of step-by-step process or checklist that you can use within your organization and also outside of your organization to develop, a framework. So, whether it's COVID-19 or mental health or HIV or diabetes care, like what topics or issues that we want to address first? And then what is our way of thinking within our organization? What is our philosophy and how we address the topic at hand, or what do we believe from an organizational perspective that's going to lead the development of the policies that we create and the procedures that we take to address the policies, and then what impact do we plan to have within our organizations to make sure that our clients are providing or receiving the best receiving the best care possible from our organizations and our services. So again, you can use this, sort of simple framework to put on paper and use this as a guide when developing policies to make sure that you are, one, addressing the issue or topic at hand, understanding what the philosophy is within your organization and in your community, and then start to develop your policies and procedures from there to make sure that you are reaching your greatest impact, which hopefully is optimal care for our clients who are LGBTQ+. And always use a community-driven approach. We want to do this by, one, developing a community advisory board, also known as CAB. So individuals from lived experience who can serve as content experts in developing programming within your organizations. You want to engage community leaders to serve on this CAB, or just engage community leaders who can be partners in the community to help you identify key gatekeepers in the community, but could also support your organization and be advisors to some of the services and programs that you might have. You also want to hire staff that reflect community members, right? This is a great community-driven approach to making sure that there's representation for individuals who are providing services to your clients that clients can identify with when they access services at your organization. And then provide non-traditional spaces for community and providers to interact. Sometimes we have, open houses within our organizations where, individuals in the community can come in and just, understand more about our organization and what we do. So that is a great way to engage community and have those sort of, off the clock conversations about what's impacting the community, and these conversations can better inform your approaches within your organizations. So I want to stop here and thank you for your participation. I know this was a lot of information in such a short period, but this is a sort of a conversation piece that you can continue to have within your organization and among your colleagues to continue to do the work in your organization. And then make sure that you follow up on the previous webinars that have happened to sort of connect the dots, and make sure you stay tuned for webinars that will happen in the future. So again, thank you so much for joining this talk today on policies and practices that impact the best health outcomes for our clients. Again, I am Dr. Darrin Johnson, the Executive Director of BU Wellness Network, and I look forward to working with you all in the near future. Thank you.
Dr. Johnson, if providers are interested in connecting with BU Wellness Network on your services, how can they do so, and what services would you recommend?
Absolutely. So BU Wellness Network is primarily an HIV prevention and care organization. We provide non-medical case management, HIV and STI counseling testing, support groups. We have a food pantry, we have a clothing pantry, and a host of other supportive services. You can contact myself, Dr. Darrin Johnson, at djohnson@buwellness.org, or you can visit our website at buwellness.org. You can also call us at 317-931-0292 to find out more about our programs and services. I also want to add, in addition to those supportive services, we also provide trainings for providers on LGBTQ cultural sensitivity. We also provide trainings on race, class, and privilege for individuals who are looking to support their staff on having conversations around race as well. All right, thank you.